All right, let's talk about fluids and electrolytes. You're going to see these questions on your nursing exams, and for a really good reason. They impact pretty much everything, from blood pressure all the way to heart rhythm. Getting these right is absolutely non negotiable. So, in this explainer, we're going to cut right to the chase and focus on what you'll actually be tested on, how to spot imbalances, and master those must know electrolytes.
So, why is this on every single exam? Well, it's because fluid balance is just fundamental to patient safety. See, your exams aren't just about memorizing facts. They're testing if you can spot a patient heading for trouble from something as simple as a fluid imbalance before it becomes a full-blown crisis. That's the critical skill we're building today.
Okay, so here's what we're going to cover. We are going to compare dehydration versus fluid overload, nail down why daily weight is so darn important, and then we'll break down the big three electrolytes. That's sodium, potassium, and calcium. And finally, we'll wrap it all together with your top nursing priorities.
Let's kick things off with the why. I mean, why are we so obsessed with fluids in the first place? It really all comes down to what they actually do for the body.
Think about it like this. Fluids are basically the oil that keeps the whole engine of the body running smoothly. They maintain blood pressure to perfuse our organs, which is just a fancy way of saying they deliver oxygen-rich blood. They also help control our temperature and are absolutely vital for every single cell to work right. Now, this is all a constant balancing act managed by what we drink, what comes out, and our kidneys. And here's your big exam tip right here. It's always about the trend. One single number doesn't tell you much. You've got to look at the pattern over time. Okay, so if we're all about tracking trends and balance, how do we actually do that as nurses? Well, this is where your fundamental assessment skills really shine. And here it is, the number one golden rule you absolutely cannot forget for your exam. If you had to pick just one thing, daily weight is the single best indicator of a patient's fluid balance. Full stop. It's more accurate and more sensitive than pretty much any other measurement you can take. Okay, lean in for this one, because this is a classic exam trap they love to use. We all learn to do the little skin pinch to check for turgor, right? But for older adults, their skin just isn't as elastic anymore, so it's a totally unreliable sign of dehydration. A daily weight, taken at the same time on the same scale every day, is always the better, more accurate choice. But, of course, daily weight is just one piece of the puzzle. You've got to put it all together. You combine it with strict intake and output, your I's and O's. You watch the vitals for any changes in blood pressure or heart rate. You listen to the lungs for crackles. You check for swelling or edema. And you keep an eye on their mental status. All of these things together paint the complete picture. All right, now we get to the main event, the problem you're going to be asked to solve over and over again, spotting when that balance is out of whack. And really, it can only go one of two ways. Either you have too little fluid, which we call a deficit, or way too much, which is overload.
So let's put these two side by side. It makes it so much easier to see the difference. On the left, with dehydration, the body's freaking out a little. It's trying to make up for that low volume, so the heart rate goes up, tachycardia, but the blood pressure starts to drop. On the right, with fluid overload, all that extra fluid has to go somewhere. It backs up into the lungs, causing crackles. It swells up the tissues, causing edema, and it pushes the blood pressure way up.
And here's a massive clinical clue and a super common exam question. You know when your patient gets dizzy or their BP just tanks when they stand up, you have to immediately think dehydration. That change in position just proves there isn't enough fluid in the tank to keep the pressure up and stable.
Okay, you can't really talk about fluids without talking about electrolytes. They go hand in hand. For your exams, you really need to be a master of the big three: sodium, potassium, and calcium. So let's lock in the main job for each one. First up is sodium, and I want you to burn this into your memory. Sodium equals neuro. You see sodium on an exam, you immediately think brain. Its main job is tied to fluid balance and nerve signals, so when it's off, you see neurological symptoms first. And check this out. It doesn't matter if the sodium is too low, hyponatremia, or too high, hypernatremia. The big symptoms are always neurological. Confusion is a big one for both. But with severely low sodium, you've got a major seizure risk. That makes it a huge safety issue. All right, next up is potassium. And if there is one electrolyte you need to have a massive amount of respect for, it's this one. For potassium, the magic word is heart. Potassium equals cardiac. It's absolutely essential for the heart muscle to work, and any little imbalance can be life-threatening. And just like with sodium, the problems happen on both ends of the spectrum. Both low and high potassium can cause muscle weakness, but the real life-threatening danger is what it does to the heart. Both high and low levels can trigger deadly arrhythmias. That's why a critical potassium lab is a drop everything and acts now situation. Okay, listen up. This is probably the single most important safety rule in this entire explainer. It's on the screen in all caps for a reason. You never, ever IV push potassium. Ever. It will literally stop the heart. It always has to be diluted, on a pump, and given slowly. This is a non-negotiable safety rule, and you will be tested on it. So you get that critical lab value back for potassium. What do? Your priorities are all about safety. First, get that patient on a heart monitor right now. You need to see what that rhythm is doing. Then you get on the phone to the provider like yesterday, and you've got to be watching their kidney function because the kidneys are what get rid of extra potassium.
Okay, last of the big three, calcium. The key words to link with calcium are muscle and nerves. Think muscle contraction and nerve excitement. The easiest way to remember this is that low and high calcium have opposite effects. When calcium is low, hypocalcemia, the muscles and nerves get way too excited. That's where you get the tingling, cramps, and those really scary muscle spasms called tetany. But when calcium is high, hypercalcemia, it does the exact opposite. It chills everything out too much, leading to weakness, fatigue, even constipation. Phew, okay. We've gone over the what and the why. So let's wrap this up by talking about what you, the nurse, actually do with all this information. How does this fit into the nursing process?
It's a really simple but constant cycle. Step 1, assess. You're checking vitals, listening to the lungs, looking at that daily weight. Step 2, intervene. You follow the orders, right? Maybe you're giving IV fluids or a diuretic, but then, and this is the part people always forget but is so, so important, Step 3, reassess. Did what you just do actually help? And then, of course, you document everything. All right, let's leave you with a classic exam-style scenario. Think about this. You've got a heart failure patient. Suddenly, you hear crackles in their lungs and their O2 sat starts to drop. The question is, what is your very first action? What are you going to do first? Think about your ABCs: airway, breathing, circulation. How can you immediately help them breathe better? Getting these priorities right, well, that's what saves lives.